For NG tube insertion, you would start by verifying your physician's order, and you review the patient's medical history, checking to see if they've had any nasal surgery or a deviated septum. I would gather all of my equipment, perform hand hygiene, identify the patient by two means, provide for privacy, assess their mental status, and explain the procedure to them and establish a stop signal with them as well. I would then do a full abdominal assessment, assess their narrows for patency and skin breakdown, and then I would position them into a high Fowler's position, drape over their chest a bath towel or disposable pad. Then I would don my gloves. And then I would start by measuring. I would start from the tip of the nose to the earlobe, down to the xiphoid process. And I would mark that on my tube. And then I would take the lubrication and lube up 2 to 4 inches. And then I would instruct the patient to flex their head slightly back against the pillows, and I would start by inserting it into the pharynx. Once it gets in, I would instruct the patient to lean their head forward. I would tell them to take some swallows or give them a sip of water. And from there, I would slowly start inserting it 1 to 2 inches at a time, instructing the patient to swallow along the way until I get to my marking. Once I get to the marking, I would secure it to the nose with tape. Once there, I would verify the placement. If it's the initial placement, I would verify it using an X-ray. If not, I would check the patient for respiratory distress, or I would aspirate stomach contents. So I would take the syringe and pull back some stomach contents, clamp it, and put it on a pH strip. If it's between 0 to 4, it means it's in the stomach. If it's higher than 6, it's in the lung or the intestine. I would also observe any of the characteristics of the aspirate. And then once the placement has been confirmed, I would mark the tube's site with a marker and then measure the length that's outside of the tube. I would clamp the tube and remove the syringe, and then I would secure, once the tube is capped, either leave it or attach it to suction. I would attach the tube to the gown, provide oral hygiene, return the patient to a comfortable position, remove gloves and perform hand hygiene, and document the procedure.